Hello, you beautiful people. Thank you so much for joining me on Conversations in the Clinic. I'm Dr. Kelly. Full transparency. I am recording a whole bunch of these podcasts and sending out my newsletter on April 6th because I am 38 and a half weeks pregnant and I want to keep serving you guys and stay consistent with this. But I have no idea what my status will be in a couple of weeks, and hopefully everything goes smoothly. But in my attempt to continue to serve you, this is full transparency with you guys here. So let's get into it. Today's episode is about vital signs and signs of vitality. And it's appropriate because hopefully everything went smoothly with our baby. And I can guarantee you that when I go into the hospital, they are going to check my vital signs. Most of us are really familiar with vital signs. They are our heart rate, our respiratory rate, our blood pressure, our body temperature, and our oxygen saturation, the little thing they put on our index finger to tell us how effectively our body is using the oxygen that is available to it. Each one of those is an objective measurement that gives us a really good snapshot of what the heck is happening immediately with the person and the patient in front of us. Um, it, it's a snapshot. If you track them over time, so like some of them are helpful to be tracked over time, like your heart rate at rest is a great thing to track over time. Your blood pressure in non-stressful situations, great thing to track over time. Even like your body temperature, like I have friends who are dealing with fertility issues. They say like that can help figure out like as you're ovulating and your body's sensitive to that. Respiratory rate, I guess over time would be helpful, and oxygen saturation, maybe over time is helpful. Um, but those, they're really like if you call an ambulance, that's the first thing that they're gonna look at. They're gonna check the person's vital signs, and they're vital. They're really important, but they don't tell a story about a person's health. They don't. And what I've started to learn and realize, because I've been in this long enough now, where some of my patients and my movers, I call them, have trusted me with their health for years. And there are a certain, I'm not even going to call them a battery of tests. There are certain tests that I will do with them that are kind of standard in physical therapy that are not standard anywhere else that really we had to do for like insurance purposes to show like we were making some kind of progress. But once I stopped taking insurance, I learned like, oh no, these are actually really helpful prognostic indicators of how a person might function next year and 10 years from now. And really, not everybody thinks about the next 10 years. What about your last 10 years? What about your last 5 years? What about your last year? What do you want that to look like? So, what I decided to do was put together these like signs of vitality. And I came up with 12 of them, and each of them have a criteria of like they have to cost next to nothing. They have to be able to be done by a lay person, and they need to take like less than 5 minutes at the most. Um, and most of them have to have some type of research behind them, some type of like, yeah, evidence-based, peer-reviewed reason that we're asking people to do this, not just like a party trick. Okay. And here's what they are. I turned it into a book. It's my email list gets it for $9. Everybody else it's on Amazon, I think, for 20. And it's these 12 signs of vitality. I'm going to tell you what they are. In no particular order: waist to height ratio, resting heart rate, grip strength, consecutive push-ups, jumping or jump rope, functional reach, farmer carry, 5 times sit to stand, floor transfer time, deep squat hold, walking speed. And then sit to rise. That's the 12th one. Again, all of them cost next to nothing. Grip strength, you need a handheld dynamometer, which is like $30 on Amazon. Most people have a measuring tape at home. Most people have a pen and a pencil or a reusable grocery bag and a gallon of water and a chair and a floor. Okay. They're not gold standard tests. You need a DEXA scan and x-rays and all kinds of cool imaging to have the gold standard, but they're good enough. They're certainly good enough. And they all have like a threshold to them. They all have ways that we can improve them, ways that we can modify them, ways to track them over time. And you got to look at them on January 1st and July the 1st. And if you just monitor those two things, think of it like going to your dental hygienist and getting your teeth cleaned. You do that so that you avoid a expensive dental surgery in a couple of years. You do these to avoid an expensive orthopedic surgery in a couple of years. Um, so if you've been a patient of mine, we have undoubtedly done at least one of these, probably five or six more. Um, and they're so simple. They're so simple. You think like, oh, how could this work? I see it every day. The people who are vital in their last year of life can pass a lot of these or have made them a priority in their last 5 years of their life. And the people who struggle are frail and usually suffer from other metabolic conditions, right? They have a diabetes or they have an Alzheimer's or a dementia, something like that. So if you want to get the book, I'll put a link in the description for getting the book. Um, Otherwise, you could just Google any of those and do them on your own. But knowledge is power, but knowledge without action is really nothing. So um, I hope that helps. I hope that serves you guys. Keep track of them over time. Keep moving. Thank you as always for your time, energy, attention, and effort. And keep getting better every day.